important topic, that is compartment syndrome. So compartment means a space that is surrounded by a relatively inelastic uh, substance, like in muscle compartment, muscle fascia, or surrounding muscles, like abdominal compartment, like brain, cranial cavity. At that time in brain we call it as intracranial pressure rest, but generally it refers to increase in the pressure of the compartment. So what really happens after the pressure inside a compartment increases is whatever the pressure with which the blood is going into that compartment. For example, imagine a calf muscle surrounded by fascia. If calf muscles are injured and there is a swelling and fluid collection inside the calf muscle face compartment, then that pressure will not allow the blood to flow into the calf muscles. So that will lead to ischemia of the calf muscle and eventual rhabdomyolysis. So this is the problem with the compartment syndrome. It hampers the blood supply and oxygen source reaching to the muscles. Imagine in leg there is compartment syndrome. What could be the cause? Like anything that is added to a compartment, like blood, extra blood, like hematoma, DVT, blood pressure increase in the compartment, arteries in injury, soft tissue injury that causes edema and increased pressure, which may be due to cross syndrome, burn, repetitive exercise, or seizure, or if something is getting compressed from outside, like a scar, circumferential scar, or a cast that is compressing the leg. So that will increase the pressure. Either the volume is decreased or the content is increased inside the compartment, that increases the pressure. We know the Boyle's law, right? If volume decreases, pressure increases. So if content increases also, then pressure will also increase inside a closed compartment, in a relatively rigid compartment. So presentation basically, first is pain out of proportion to the severity of illness. So excessive pain, for example, there was a fracture, patient was all right, he did cast, next day patient came with excessive pain in that area, then that should make you suspect about the compartment syndrome. Pain increases to touch stress. Like in DVT, similar to DVT, like we have Woman sign, pain increases on passive stretch, and the compartment becomes very tense. Like in abdominal compartment syndrome, abdomen becomes very tense. Similar to that, the compartment, whichever is involved, becomes very tense, like wood like tenseness in the muscle compartment. Earlier feature is one of the feature is paresthesia. Patient feels paresthesia distal to the compartment. So basically due to compression of the nerves passing through the compartment. Reduced distal pulses are late findings. Motor weakness, and since there is a blood supply not going properly, there may be pallor, decreased temperature, decreased pulse. So due to nerve compression, arterial compression. Features are arising due to that. So diagnosing is measuring the pressure using a striker needle, or measuring the compartment perfusion pressure, also called a delta pressure. For measuring the pressure, we can use catheter, different types of catheters, transducers. Management is basically fasciotomy, cutting the fascia open, or escharotomy. If it is a scar, then which is scar we from brown, which is causing the compartment syndrome. If it is severe and the limbs are not salvageable, amputation. And fibulectomy can also be done, but not uncommonly if it is happening in the leg. Complication is basically related to the rhabdomyolysis and ischemic contractures. Okay, that is about compartment syndrome.